video is a demonstration of diaphragmatic breathing and the relationship between the diaphragm and the pelvic floor muscle for core stability. The diaphragm is a dome-shaped muscle. This is our respiratory muscle that is situated between the thorax and the abdomen. The pelvic floor muscles, which is part of the intrinsic core stabilizing system, is at the bottom. It's another dome. It's an inverted dome, and this is the support system for our pelvic basin. When we breathe in, we're bringing oxygen into the lungs, so we want to increase more space into our thoracic cavity. The diaphragm contracts. That means it flattens, which creates more space and air goes into the lungs. What happens at that point is that actually puts more pressure down into the system, increasing intra-abdominal pressure, and the pelvic floor muscle will yield, will also be dropping down. On the exhale, it's just the reverse. The diaphragm goes back into relax. The pelvic floor goes into a recoil, and it starts all over again with the inhale. So inhale is a contraction of the diaphragm, pelvic floor yields, and the exhale, diaphragm goes back to its dome, and the pelvic floor recoils back to its resting position. This movement here is what is really important. This excursion of the diaphragm and the pelvic floor is creating this reflexive stability for our core. We need this movement to be able to have this, not that rigid stability that we think of when we have our six-pack abs. We have this fluid stability. So what we want to be able to have is this diaphragm contracting. Now, we also have another way to breathe, and that is up here in our thoracic outlet, so up here at the top. What happens with this is we get a lot of chest lifting, we get the ribs coming up like this, we get the shoulders coming up, and the sacrifice to that is we can create more space in the cavity here, but it compresses the cervical vertebrae, and it can also increase more tone in this area. So even though that is a way to breathe, in the long term that is just not an effective way overall to be able to have this reflexive core fluid stability, which is what we want to be able to do. We want to be able to have this motion of our diaphragm in the pelvic floor in order to maintain the homeostasis of our autonomic nervous system, our fight and flight, and our rest and digest. When we have this diaphragmatic movement, that means that we are having more access to our parasympathetic nervous system, which is our relax. So if you think about how many times we're breathing a minute, which is usually 12 to 15 times in a minute, you add that up, that's quite a bit of breathing that happens in the day. So if we're doing a lot of chest breathing, that can create quite a bit of compression in the neck, tension up in here, which can also lead to a cascade of events of increased muscle tone because we're not getting that good respiratory movement and the parasympathetic nervous system down training. So let's notice how we're breathing here. One of the great ways to do that is to just let your hand rest, one on the chest, one on the belly, and see about your breathing. Just take note. Do your normal breathing here, and what do you notice? Now for some people, what they might notice, for me, I notice that my belly will kind of expand and then go back. For some people, you might notice that there's more activity up here moving up and down than there is here. When the diaphragm contracts, what we should notice is a slight movement here at the belly. We should be aware here at the pelvic area of relaxation or letting go of the pelvic floor muscles. Once you start to tune in, you can really start to feel the dropping and the letting go of the muscles, or the yielding on the inhale and then the recoil on the exhale. Another place to put your hands is on the rib cage. On the lower ribs here, when the diaphragm moves, what we should be able to experience is outward movement of the rib cage in that expansion of the contraction. The side walls are moving out side to side and front and back. Place your hands on your rib cage. See if you can feel the movement coming into your hands, these side walls. You should be feeling the ribs coming out at you. If you can't feel that, that's okay. That's going to take practice. It can be helpful to have your hands here as a tactile cue to be able to get that representation into your body map. And if that's challenging for you, maybe you can just let your hands come to the side. You can close your eyes so you can try to connect into your whole body frame. And if you know you have a tendency of really ramping up here, see if you can just focus on keeping this relaxed and dropped. Allowing that breath to drop down in the diaphragm movement on the inhale. This relaxation of the abdominal muscles and the pelvic floor. Knowing that that takes practice, I suggest to a lot of my clients to take a little check-in 5 times a day, take 3 to 5 breath cycles, and just bring your awareness to your breath. Get that respiratory diaphragm moving. For the health of our muscular system, for the health of our autonomic nervous system, for the mind and the body, breathing is essential.